Morning. I'd like to call the Executive Committee meeting for August 26, 2020 to order. Can I get a roll call, please?
Mr. Lear?
Present.
Mr. Hess?
Present.
Mr. Tholen? Mr. Byrne?
Present.
Ms. Weber?
Present.
Mr. Payton?
Present.
Mr. Kinzinger?
Present.
Ms. Haas?
Present.
Mr. Featherling?
Present.
Mr. Miller? Mr. Hunter?
Here.
Mr. Seroy?
Present.
Mr. Wheeler?
Present.
We have a quorum.
Thank you. I have no public comment today. No presentations. Approval of minutes from July 29th, 2020. Is there a motion? Mr. Byrne, Mr. Hess with a second. All the Zoomers, so we have to do a roll call, please.
Mr. Payton?
Present.
That's an aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Seroy?
Aye.
Those in the room, all those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. Before we get into legislative, I just have a couple of things to clear up. The first thing is I received a notice from the coroner this morning. I thought it was important to get that out of the way at the beginning so the people that are watching from home can see and hear this. Facebook has shut down the coroner's Facebook page. Apparently it was reported by somebody for being either fake news or hate or something. And I've been talking to Bob this morning, and they just came out with a press release. I'll just read this quote. "It is disheartening that in the middle of a global health pandemic, Facebook has removed our page, which has been a source of honest and truthful information over the past several months. As an elected official and leader within our county, it is my duty to enhance the community partnerships and education throughout the county to provide awareness to issues such as COVID-19. My staff and I have worked hard over the years building the office of coroner to one known for professionalism, integrity, and honesty, and we will not let the actions of Facebook officials change that. I find this extremely disturbing that Facebook would take a government information page down without any due process whatsoever, something that people depend on a daily basis for information. It's frightening. I think this should be alert to anybody, whatever political sphere you're in, that one day you're the thought police and the next day the thought police come for you. You need to keep that in mind, because you may not agree with something, but that doesn't mean that the tables can't turn, and it needs to be fair and it needs to be due process. I am shocked and appalled that this could actually happen in America. It's wow. Sad. It's just sad. So the other thing I wanted to mention before we get into business is you all probably got a call yesterday. I got a call from somebody in the morning that I said a total of, I believe, 19 words to, which they were, "Hi, this is Andy, what can I do for you?" And the rest of it was, "Hey, I appreciate the input, have a great day." And I got yelled at for the minute and a half in between those first set of words and the second without any opportunity to have a conversation. So apparently board members were being called and told that I hung up on somebody. That is not the case. I listened to the person. They yelled at me. They didn't want to have a conversation. I thanked them for their input and said, "Have a good day." So now you know exactly what happened, okay? Because apparently all those phone calls happened throughout the day, and that was the extent of it. I'll just leave it there. Under information services, under legislative, Steve, do you have anything today?
Thank you, Mr. Chairman. Yes, Monday I attended a webinar that covered 3 different topics. The first was how current events are impacting and shaping law enforcement for the counties and other public entities. The presenter was Jack Ryan. It was really a pretty technical webinar in terms of issues that the law enforcement community would deal with. The one thing that might be of note in terms of this county board is the importance when if a lawsuit ever arose in terms of police behavior, the county could become the empty chair defendant if we did not have appropriate policies. I'm confident that we do, and so that's not really a concern, but something that we need to be aware of, that we get involved only from a policy standpoint. The second topic on this UCCI webinar were the emergency rules and local liquor and public health regulations as related to COVID. The most important thing there, I think, was the recognition that the state has traditionally deferred to the local community on most issues. We see that's not happening right now, of course, in terms of COVID, and the passage of the emergency rules creates a different kind of situation. In terms of the first webinar for a moment, I would go back and say there was a PowerPoint presentation which has been made available, and if anyone would like a copy of that PowerPoint presentation, I can provide it. There was no presentation on the liquor regulations, public health items. The third topic was COVID-19 issues in the county workplace, and focused on two pieces of federal legislation that had been passed very early: the Family Friendly Cares Leave Act and the Expanded Family Medical Act. I've spoken to our county administrator, and all of that information way back in March has already been distributed to our employees, and so those notices have been taken care of as I expected would have been true. There are some things that I think may be topics for Finance Committee that we might just touch on briefly, although probably that we won't deal with any of that until September.
Alrighty, any questions about any of that for Steve? I believe, I don't know if Anita, you guys have those PowerPoints too. They were on that call as well. So whether it's Steve or administration, let us know if you want a copy of that information. Anything? Okay, thanks, Steve. Under information services, Kevin, do you have anything for us today?
Yeah, so just, you can hear me, right?
Yes.
Okay, just give you a brief update after the storm and how it affected the county network last week. For a brief period of time, it hit us pretty hard. As you know from some of the other committees, 189, it took out their air conditioner unit for the server room, and that's critical for this building. That server room cannot reach over 89, and we have enough servers that if it goes for very long without air conditioner, it'll go well over 100. We were able to work with the maintenance department. We were able to keep that temperature down until Wes was able to obtain a couple temporary air conditioner units that are still running there now, because apparently our dedicated air conditioner unit for that server room is especially.
Yes. Hey, Kevin,
Yes.
We can't hear you in this room. Are you able to get closer to your mic, or?
You can't hear me?
Now we can.
I'm sorry, maybe I'm just talking too soft. Can you hear me now still?
What? No, I'm
Can
just
you-
kidding. I'm just kidding. Go ahead.
Okay, I'm sorry. Again, the air conditioner unit, as if you've heard that part, I don't want to repeat myself, was taken out of the server room. It's critical to make sure that we keep it going. That room cannot reach over 89. We worked with the maintenance department, and temporarily they were able to obtain a couple of very large air conditioning units still running there today until they can find the parts for the air conditioner in that unit. If we lose that server room, because the servers would shut themselves down, no one in this building would be able to operate. We wouldn't be able to serve anybody because we don't have anything that's done by paper anymore. So it's critical that we keep on top of that. I got to thank Wes for getting us temporary units as fast as he did. I assume that will get fixed at some point, but it's working fine now. I believe he'll keep you updated in his committee. Going to the courthouse, that got hit really hard. That took out their internet, the Comcast business, for over a week. I always have a backup for the county. We have two internet sources, providers at all time. What I did when internet went out for over a week at that building is I had it set up where I transferred the users over there to our building's access, which is actually more than theirs. And we're on AT&T, they're on Comcast. We're on fiber, they have a smaller bandwidth. That worked for their for their employees. We had to wait on the server for 36 hours because that's a much more complex procedure to transfer that. After 36 hours, I see that Comcast wasn't going to bring that back up when we brought that server over too. So now they're on our network here, and we're going to keep them here because we have a better grade of internet access in this building. Comcast came back up about a week later. We're going to keep it, but we're going to keep it now as the backup for us because we always want to make sure we have two providers, because it's rare that both providers will go out at the same time, and we need to make sure the county can always operate. Almost everything that the county buildings do are online, between email communications, the treasurer, when it deals with the banks, that's online, the finance, everything is online, so it's critical that we keep the internet going, keep email going. And then lastly, on the annex building, when that storm hit, it took out a couple of key switches, so the whole second floor was out. But I always keep a backup supply of switches, so we were able to put that in place and replace that and get them back up. Again, our procedures for emergency situations worked, so that's good to know. And we're replacing those units that were the backup units now. And if it happens again, we should still be able to have a mechanism to keep the county going. And that'll be it, unless you've got some other questions.
Any questions for Kevin? All right. Hearing none. Hey, thanks, Kevin. Appreciate it.
Thank you.
Anything under VAC today? Is there anyone here? Doesn't look like we have anybody. There's no report this month. County Administrator's report.
How about the health department?
Yeah, we'll make him wait. No, we'll go under Health Department. John, would you like to join us?
Trick question.
Yeah. We were waiting to give you like the whole last half of the meeting by yourself, so.
Coaches tell me I should always, less is more, so. Good morning, everyone. Obviously, I've got a number of things here that I could discuss and prepare, but I think we're all aware that as of today, this morning, based upon the governor's press conference yesterday, and information that really Andy and I only officially found out on Monday was even going to be happening in regards to this, but our region, the Will County Kankakee region, has been placed under more stringent mitigation factors, similar and not similar to what they did to the Metro East Region 4 area last week. Do you need me to go through those, or do we feel like we know what all those are in relation to?
What's the pleasure of the committee?
Yeah.
Okay. That's a good point. Okay, so the mitigation factors that are going into effect as of this morning. Bars, no indoor service. All outside bar service closes at 11. All bar patrons should be seated at tables outside. No ordering, seating, or congregating at bars, the bar stools. Now, the language that we got says should be removed. The governor yesterday stated in his press conference said has to be removed. So, but regardless, no indoor activity is to be taking place. Tables on the outside have to be 6 feet apart. There's no standing or congregating indoors or outdoors while waiting for a table or exiting. There is to be no dancing or standing indoors. Reservations are required for each party. No seating of multiple parties at one table. That is the requirements for bars for the next 2 weeks. For restaurants, no indoor dining or bar service. No outdoor dining. Closes at 11, similar to the bars. Outside dining tables should be 6 feet apart. No standing or congregating indoors or outdoors while waiting for the table or exiting. Reservations are required for each party.
no seating of multiple parties at one table. Those are the mitigation factors for the restaurants. Meetings, social events, and gatherings, limit of lesser of 25 guests or 25% of overall room capacity, no party buses. Gaming and casinos close at 11 and are limited to 25% capacity, and follow mitigations for bars and restaurants if applicable. These mitigations do not currently apply to schools, and the measures will remain in effect for over a 14-day period, after which time more stringent mitigation measures can be implemented if the metrics do not improve for our region. And then they give information on where the mitigation metrics can be viewed. Obviously, IDPH has that information on its website. The health department has that information on its website. I'm not sure if the county links, informationally, through yours, to visit the health department for people who are interested in seeing those numbers on where the state sees that. I will say that the metrics that the governor has provided runs a week behind. If you look on those metrics right now, it states that it's as of 8/16, I believe, whatever last Friday's date was, the 15th.
Yeah.
Thank you. So the new numbers for last week won't even come out until the day after tomorrow. So this information that they were giving us about the region going over the 8% for 3 days, which was the Friday, Saturday, Sunday, or was it Saturday,
19,
Sunday,
20,
Monday?
21, yeah.
So the 19th, 20th, and 21, our region was being told that we were going over 8%, which was what was triggering these mitigation factors. To be honest, I'm struggling trying to find that information where you can see that. And so your frustrations are my frustrations. I have to take it on faith that the state is telling us then what they see. Unfortunately, that data is not kept up to enough of a consistent, quick enough basis for us to be able to see that. Kankakee County, obviously, and I want to say this now, because I've tried to say this twice in articles to the newspaper, the quote's being left out. My opinions don't necessarily matter in this. The health department has its job that it needs to do, and it will do, and I pledge that support for the community and everybody in regards to continuing to do, to fulfill the mission of the health department, to monitor the health through our contact tracing, to promote, health, and to educate through the efforts that we've done with Andy and this Healthy Business Alliance. I want to applaud all of you and all of Kankakee County for what we have done for the last 6 months, the things that we were asked to do and did above and beyond even what we thought we were going to be told to have to do. And the fact that our metrics for Kankakee County as a standalone county reflect that we've been doing that. We're only over on one of the metrics, and that's because of the cases that we are having. It's putting us over on the metric of per 100,000 people. We are not over on the positivity rate. As near as I can tell, as of last Friday anyway, and based upon the numbers that we've been seeing in the past week that we post for our cases, we're at around 5.5, even for giggle's sake, if we said we're at 6%, which means then that because we're in the region with Will County, their numbers are higher, which is driving the percentage overall on an average to 8%. As a result of that, that's what's triggering our region. So again, I want to say thank you to everybody for what they have been doing, and we're asking your support to continue to do it for another 2 weeks, for these 14 days. Will County is pledging their support to do so. They want to get their numbers back in the blue. If they do what they need to do, and our county, for whatever reasons, if people don't agree and are going to defy the orders, and our numbers go up, then in essence, all we've done is flip-flopped the thought of whose fault this is. And Will County in 2 weeks could have the numbers that they need to have, and our numbers have gone up. And as a result, the governor will make more stringent mitigation factors for us. I don't want that. You don't want that. I know our community doesn't want that. But I would like to say thank you to everyone in the county for what you've been doing so far, because I feel we've done one heck of a job here to be where we are as of today. That still being said, we've had these mitigation factors placed on us starting today.
Mr. Hunter?
Thank you, Mr. Beavis. Thank you, Mr. Chairman. Just had a couple questions regarding this. Is there an appeal process at all regarding this? I asked that, for an honest response, but I know before.
There you go.
I know before the chairman, Wheeler, as well as Senator Joyce and you really fought a good battle as far as removing us from our neighbors to the north via comments, written communications to the governor, et cetera. And I appreciate, the empirical stuff that you're conveying to us, and I think our citizens need to know that, what has transpired. But anyway, appeal process, any other comments associated with that?
And an appeal process in regards to
In terms of,
not being with Will County?
right,
I know that it's not necessarily my role as the administrator. I mean, I can get involved politically. I will say, however, at this moment, though, our main focus is the contact tracing, the education that we need to support, and potentially having to go out now and deal with individuals who are going to be defying these orders and blatantly putting it out there on Facebook, creating a situation for us where we know who they are, and I guess they're testing us, and okay, I guess we're going to go down that road. I don't want to, but I know that discussions, letters with Andy, Senator Joyce, Representative Parkhurst, a number of individuals, some other mayors within our community. Look, we're all not happy about this, but ultimately, yes, that is being done. It's being asked, but I don't know at the end of the day if it's going to change anything.
yeah, my concern, I'm not looking at this as a political situation. I think it's the pragmatic thing to do that some of us have talked about even before the meeting started regarding the adverse impact it's going to have upon local businesses and stuff.
I know.
From a personal perspective, I was supposed to have my grandson down here doing a little fishing this weekend, but his parents vetoed it, based upon, the press conference yesterday. But so, some of you may perceive that as something small and personal, but it's like a domino effect in terms of business, the way of life, how we conduct ourselves. I'm a believer, and of course we can't hold in-person church services, and we do a lot of stuff on Zoom, but this is catastrophic in terms of how it affects our Western way of living.
Mr. Byrne?
Thank you, Mr. Chairman. When the governor imposed these mitigations on Metro East, he rolled some back, enabling in dining inside.
Not quite.
Not quite,
He
but
never instituted that.
because that
He was going to do what he did to us today.
So I just want
He was gonna
clarification
do
because
that
there's
to
a lot
them.
of
They heard about it and they complained, and so he didn't put that step on. They changed from the day before, really. On Monday, this was going to be instituted in Madison and St. Clair counties, just what we got today. But then that changed in a day.
Okay, because
So-
because again, I myself, bring it somewhat personal. My household has been impacted dramatically in this, shutdown, and we have businesses that have, were just getting back on their feet, employees that were just getting back to work. Now this just, again, the impact, and I'm not denying the virus is, not serious and all that. I feel for everyone that's been affected by it. At the same time, the other side effects of this is it's just overwhelming, and like I said, our local economy and just area businesses and local employees that are, they're wondering how they're going to pay bills and how they're going to get by, and that's just, if there's a way to speak out and just say we support local businesses, that's and the local people who are getting hurt by this. That's all.
I don't know that there's a positive side overall for this, other than, one, it's to help reduce the numbers and cases, although our county has been doing, as I said, a tremendous job in doing that, and we need to help with our thoughts and prayers in regards to Will County being able to get their numbers down, which hopefully then helps put our region back in the blue and not having any of these mitigation factors, you know.
So just to answer both of those questions, indirectly and directly from Mr. Hunter, my communications have always been we should be considered on our own. At best, at the very least, we should have been removed from that Chicago region. Like Grundy County's a warning, but the rest of their county, their region is not. So they're not over the line in aggregate of everybody. I don't know that Cook is going to remain the way that they are now. They could be trending in that other direction. So my whole thing is, and that's what I put in the press release and in my communications to the governor's office, each health department region should be considered on its own, because we don't have, in my opinion, we have no authority over Will County. Will County's health department can't come down here. They can only manage what they have a mandate to manage, is their own area. So if there's bi-county or tri-county health departments, why can't they be a region on their own? Because they're the ones doing the work. That's only logical. So I just wanted to mention that. Now they're in unison. Everybody was saying, get us out of that Chicago region. My message was a little more specific, but that's I still think that's the answer, but that's just my opinion.
Mr. Chairman?
Well, let me go with Mr. Hess first, and then I'll get to you, John. He had his hand up. We'll come right to you. Go ahead,
Thank you,
Bones.
Chairman. What you just stated was good part of my question, but would you like to comment on the letter that you got from Mayor Watson for Bradley? About moving forward?
I can mention that. There was a letter, I've seen it on the Facebook from Mayor Watson, and it went out to most of the mayors and to the public. And as I saw on the email at about 9 o'clock at night, the media at the same time, and basically saying that, he didn't think it was, fair. I'm just, summarizing that, but the key part of it for me is that that the statement in the press release by the governor's office, and I paraphrase, that local health officials were consulted in this decision, which is, I loved MASH, and Colonel Potter used to say horse hockey. That was horse hockey. They didn't consult us with anything. They told us what they were doing to us on the phone call. So that's about the best way to put it. I thought that was beyond a misrepresentation of the truth. It was an outright falsehood. So we were told what we were going to was being done to us, and not consulted with what should we do. So that's the part and I think that's where Mayor Watson might have had an issue, is because he's like, well, where's our voice? Who consulted us? Well, just so everybody knows, we weren't consulted. We were told.
That was the point that I wanted to bring out.
Yeah.
It stated that everybody was consulted, but we know they're not.
I in reading that statement, I got a copy of that too, and I appreciate the correspondence from Mayor Watson in regards to that. And I hope he wasn't implying that he felt that the county health department here in Kankakee was somehow in secret negotiations with the state without letting anybody like Andy Wheeler or Chairman Wheeler and any of the other mayors know what we were trying to negotiate here, because as Andy said, that was not the case. But I think what he should have said in a better way was maybe when he was getting ready to do what he did to Metro East, he may have been in contact with the health departments in relation, because that's where yesterday one of the questions that he answered in his press conference was that he negotiated this 2 weeks and changing from no indoor dining for them either to at least allowing them the indoor dining for a period of time. And now he's saying that that's not working. Their numbers are still going up. And so when he went to put our region in the orange and give us mitigation factors, I can assure everyone here, to Andy, and Andy knows this because we've been talking since Friday, every day in regards to what we thought was supposed to happen this Friday, and they did it to us on Monday, is that the health department in no way knew that this was happening, and they made these new decisions, and whenever they decide to do something for a third region, they could create something altogether different from what they've even done for us two.
It's accurate. So let me get to Mr. Featherling and then Ms. Dunbar, and then I have another at least piece of information to share regarding this. So, John, did you have something?
Good morning. Good morning, Mr. Beavis.
morning.
I had a couple quick questions. When they use the total numbers for test, they come up with the percentage, the 5.5 or whatever. I know it's based on how many people get tested. How many people get tested? They actually think they're sick and they go get tested, or they drive by and see it and go ahead and get tested? Do you have that statistic, or nobody fills out anything like that?
I don't have
Do they
those.
have any symptoms, anything?
I don't have those specific numbers in front of me. When people get tested, whether it's at the hospitals at Amita St. Mary's, for example, or at Riverside, or they might go to Aunt Martha's, or they go to CVS, or any of the facilities right now that are doing the testing, those tests through those facilities go into an electronic system that goes to the state. So they see those numbers kind of as they happen. We don't necessarily see that at the health department. We get given the information on the individuals that test positive, and then the state obviously will put out every day in a press release indicating that 51,000 tests, for example, were done on a given day, and then this is how many people were positive for the state of Illinois. We can see that within Kankakee County on a given day, we might have 2,000 tests attributed to our county, and then here's our positive cases, and that puts our positivity rate at such and such. Like I said, the last number that I've seen officially as of last Friday was 5.1%. So we're well with under the 8% threshold that they want to do. And then yes, to what you ask, people are going to get tested because their work is requiring it. Some people are getting tested because they're curious. Some people are getting tested because they're sick and they don't feel good. Some people are getting tested because they're getting ready for a medical procedure and it's necessary before the hospital will do it. So there's a number of reasons that people can get tested. Obviously, the more people that do get tested will help push that positivity rate down, but there's no law that requires them to get tested, and at some point people, the market could become oversaturated. People lose interest. They don't, they feel good. Why should I get tested? I don't get tested for mumps and measles if I don't think I have them, for example. So those are the types of things that we're dealing with. Did that answer your question?
No, actually, the other part, oh, yes, it did. Okay, thank you. I got one more part, though. If people go and the gets a test done, he doesn't want to find out he's a asymptomatic person, they probably don't want to go get tested. Is that true? If they feel fine, they don't go get tested, but if they think they don't feel well, they get tested. So positivity rate is higher. So to encourage more people to get tested would be a better ratio according to what the governor has laid out. Would that be true?
I'm not sure I follow along.
So like if you still had, using numbers, not our numbers, say you had 50 positive cases and you tested 400 people. If you had 600 people and you only had 50 cases, then your numbers way down. So people that are testing are going to test negative are afraid to go there because they're going to go through the contact tracing situation where they got to go back and lock everybody up that might have been asymptomatic, just they are.
I guess if I understand what you're saying, theoretically, yes, you could have individuals that aren't feeling good, that for sake of not wanting to lose their job or just don't want people to know they're sick or miss their work for 14 days if they are positive, aren't getting checked, and you have people who feel fine or asymptomatic as you described and will go get tested and are negative or could be positive. But obviously, look at it, an easy statistic. If 10 people get tested and one person is positive, that's 10%. That's over the governor's metric right there. So, but if 100 people get tested and one person is positive, then we're doing really well.
Yes. Okay. Thank you. Yeah, that answered my question right there.
So I think in a roundabout way, yes, more people being tested is a good thing. The other thing I would mention that when this is the way it kind of went down on Monday, we had to call with Dr. Ezike, and all the stakeholders in Will and Kankakee counties, the senators, representatives, everybody. Then I got off the call. I talked to the sheriff and the state's attorney. Then we got on a call with the hospitals and John. And so and that was a longer call. It was a good hour and a half, 2 hours, I believe. And we went through all the different scenarios. So the statements that I made on behalf of the board were made in consultation with the health department and the two hospitals. So they were impacted by the medical community and what's actually going on. There's one thing that people need to realize, that when people go in for a procedure, they're being tested for COVID. So when they're in the hospital having a procedure and they test positive for their, they're having knee surgery, that's a COVID hospitalization. Okay, and those numbers are, what was 3, 2, 3, something like that. Even outside of that, there's just we're not seeing it right now as far as hospitalizations. So I want to temper what you're hearing. One hospital I believe is still testing people through a doctor's order. The other one, you can, I think, go in and get a test, I believe, still. I don't know if Riverside has changed that or not recently. But regardless, more testing is needed to drive that rate down, but we're going to have to do it 7 times as much as we are right now, because Will County has 700,000 people. Does that make sense? The statistics bear out in that aspect. We could do everything even better than we are right now, which is better than average. We're doing pretty good, and it still won't matter in this situation.
That's exactly right.
We're just, and I don't think there's any other regions that are 2 counties. As I look at that map, I don't remember any others. You got Cook County, but that's not, that's millions of people. Then you got, I think we're the only one that's just a 2-county region. And if their populations were similar, then statistically that would bear out. So I just want to put some perspective behind this. Our hospitals are comfortable where we're at. Nobody likes to see any deaths, but they know what the real situation is, and they're not alarmed with what's going on here in Kankakee County. Let me get to Ms. Dunbar, and then I'll come back to you, Bones, okay? Go ahead, Beth?
Thank you, Chairman Wheeler. Mr. Beavis, I appreciate all the information that you've given us and putting it all into perspective, because it's a lot of information to take in. My question is about enforcement. What does the governor's order expect from you in terms of enforcement? Do you have the staff to do that? What are the things that, are you gonna go, prioritize what's going on? Can you address that a little bit, please?
Yes. I prepared a really good statement for this, I hope. The mission statement for the health department is to promote, protect, and monitor the health of all the citizens of Kankakee County. Our number one priority is going to be monitoring the health, and we do that through the contact tracing, and we have been doing that from day one. The second thing that we're going to do is promote working with the community partners, and we've been doing that from day one with this Healthy Business Alliance, and continuing every day to have these discussions, as we've said today, to provide the education to everybody as it changes daily, and getting that information out on the social media platform, as long as our websites don't get taken down, and getting that information out to everybody. The third thing is protecting the health of the public. And so in regards to that question, the governor 2 weeks ago changed and created a law within the communicable disease section where he, took a may and made it a shall for health departments and law enforcement to enforce complaints on masking and gathering situations. The system or the process is going to be as such. A formal complaint gets made to the health department. The health department will investigate the complaint. The business is found to be complying. They will receive a notice for their records that the investigation was completed and that they're complying, and we go on and everyone has a great day. If the business is not in compliance, the ruling allows us the flexibility to give them a warning in the form of a written notice that you're not doing what you're supposed to be doing. Here's what you need to be doing to be complying, and we will give you a time frame in which to make those corrections. This is similar to what the nuisance policy is within what's already been approved by the county board back in 1985 when the health department's nuisance ordinance was created. If they don't voluntarily comply with that notice, then another inspection will take place. They will be given a written warning, possibly asking them to cease and desist their business, possibly asking them to reduce the number of people within the building. And then if they continue to not comply, they could receive a Class A misdemeanor and be subject to a fine. That's the process. I've worked with Nancy Nicholson and Jim Rowe with the state's attorney's office. This is what this law was changed to 2 weeks ago. This is what health departments are being asked to do. In regards to the number of people that we have 4 environmental health staff that go out and inspect 650 licensed facilities. That's food facilities, not all the other places. But right now, these mitigation factors impact food and bar for the most part. That being said, I would rather my staff honestly be out there doing food inspections to make sure that the food people eat is safe to eat and that the facilities are sanitary, the sanitation is clean, and then possibly checking to see whether they're wearing their masks and they have the signs on the doors. If we're going to be asked to do this, I can't tell you if we're going to get 5 complaints or 50 complaints. We're being told we have to investigate them.
Unfunded mandate, excuse me.
It is. It is exactly that. You're correct.
Yeah, and it's, in my opinion, you guys aren't trained to be law enforcement officers. You're trained to be inspectors and know the health codes and things like that. You're being put in a situation that is not the standard for health departments. One thing I want to make sure of, formal complaint. Do you require that in writing and say who you are and where you live and your contact information? Or can somebody just call up and throw out an accusation willy-nilly? Because that's going to happen. You're going to have a bar or a restaurant in one town calling on another one incessantly.
The best way to answer that is yes, we do have a process that a formal complaint needs to be something a little more substantial in regards to who's making it, what's being alleged, and the ability of us to investigate it so that we don't end up just, so for example, people like, we don't monitor what people say on Facebook. So every stream, following, or something that people say or do, if they're saying, well, I was at such and such a place and here's what I saw, that is not a formal complaint. We need people to, the process was, realistically, you come to the health department in person and make the complaint. Give us your name and number. It'll be confidential and we'll investigate it and we'll call you up and we'll tell you what we found out, regardless of what the complaint was. Because we're limiting people into the building because of COVID-19, we will take complaints. If you get complaints and you forward them to us on behalf of your constituents, we will make that a formal complaint because I know who you are and I believe what you're saying. But we have a lot of people, just real quick, for example, you'll get somebody who's a disgruntled ex-employee, they just got fired for stealing money, and they make a complaint and they say this place is the most disgusting place there ever was, and we were in there the day before and gave them a 90. So we know that that's not an accurate reflection of what that facility is, but we'll call that facility up and just say, hey, what's going on here? And they'll say, well, we just let somebody go because they were stealing money. Okay, we see what's going on and we close that complaint out. But yes, a more formalized complaint is going to be necessary. But we already have people lining up telling us on Facebook, this place is saying they're going to be open, or places that are saying they are going to be open, and we have places that are saying they're going to follow the rules, and I appreciate that. But it does put us in a position that we don't want to be in. It's an unfunded mandate. I don't want to have to be doing it, but it's something that it's a process that we will have to do. But with the 4 people that we have to do it, depending on the amount of cases that we're trying to contact trace that day and whether my environmental health staff have to be pushed off to do something else to help the staff out, I don't know.
Thank you, Mr. Beavis.
You're welcome.
Oh, Bones and then Jim. Yeah, sorry.
Thank you again, Chairman. Do we have any statistics at all of the false positive rate?
No, I mean, we get a positive number, it's a positive, and then the other ones in that aren't considered. So if 51,000 people are tested and 2,000 are positive, you come up with that positivity rate, the rest are considered negative. I don't know how you tell something's a false positive or a false negative without having it retested somewhere else to determine if there was an issue with that. That's beyond the scope of our work.
My question was, am I on? The reason I asked that question is the everyday person does not have the, I better watch how I say this, the purview of our athletes and everything else that are tested sometimes 2 or 3 times a day. They test positive, then all of a sudden the next test they're negative. The everyday person don't have that choice to have that stuff done. So there are negative or positive results out there that are negative.
There are also other tests out there for COVID-19 that aren't as reliable as, say, the nasal swab. There's some rapid testing, and those are less reliable. They could give you a positive and could be wrong. That's why they're less reliable and aren't supposed to necessarily be the ones, you know, it might give you a good idea, you know, should I get another test, a more specific test, or not?
Mr. Byrne?
Thank you, Mr. Chairman. John, just a clarification, you mentioned the law passed. Who passed that law? I don't think the legislature passed any laws regarding wearing masks.
I've got a helper here from the state's attorney, and I appreciate everything that Nancy has been doing. We've had a lot of conversations, almost as many as Andy and I.
Yeah, because I've been asked about enforcement with mask wearing. As far as I'm aware, that's just an executive order, which is still being challenged in the courts. Is it a law? Like you could be in trouble? Okay,
It's an administrative law. So what happened is the governor went under the Department of Public Health. He did under Title VII. So when John mentioned the addition to the communicable disease control and immunization. So if you remember weeks ago, this big hoopla was because the governor was going to add all these emergency rules. It went to JCAR and then he withdrew them. And then he came out and said, I withdrew them because the legislature said they were going to take care of it. They didn't. Neither here nor there. So what happens is this did go to JCAR. So he did institute his emergency rules. They went to JCAR on August 11th. At that time, there was a motion to suspend them. It lost. They needed a majority of 8 for it to pass. It lost. It was 6-5, so the rule stands. The rule puts the burden, as Mr. B was kind of, because we discussed it. We read these emergency rules. What the rules have done now is put the burden, though, on the business owner. So I just want to make that clear. No individual is to be penalized, not even necessarily the business owner. And I know that's weird because if you own the business, you're the one, if you have to deal with stuff or get fined, you're the one that has to bear that. But so if you own a business, I just can't come in and be like, you know, Jim, you're responsible for this, I'm fining just you. Because of that, though, and John and I have discussed this since these rules came out, there's all this reasonableness clauses that are in there, reasonable efforts. So if you own a business, if you've properly put on the door that, you know, masks are required, when you put somebody at the door when they come in, you say, hey, by the way, you need to have a mask on when you're in here. Please keep it on. Please maintain social distance. You may be at your checkout, like if you've been at places, you know, they put the little footprints of where you have to stand. If you as a business have now made reasonable efforts to ensure that people are aware that you're following these rules, we've discussed it. We believe that's a reasonable effort based on the definition, because you can't follow people around the whole time they're in the store. Maybe you have a training to your employees that if you see somebody, like, you know, not social distancing when they could, not wearing their mask, you would mention to them to do it. But other than that, we can't be the, for lack of a better term, mask police. That, you know, the Department of Health can't do that. Their primary job is contract tracing, you know, so that's where those rules are. They're not like a state statute, but they're administrative. And then they expire, what, 180 days, I believe, or there's an expiration term. I mean, they're not in effect forever.
Okay. Reason I asked, I was asked by a constituent about that, the complaint about, well, I go in the X store, why isn't the sheriff or police doing something about it? Well, and that's the reason.
Right, and while the rules give both the health department and law enforcement the shall, like John said, it changed it to shall to enforce this, there is no real, lack of a better word, teeth for us to really pursue these things. There is a monitoring, and my legal opinion is the health department, one of their main things, they're more into compliance and licensing. So they're not really into enforcement like Mr. Wheeler stated. There currently are no criminal laws on the books that would allow us to ticket and bring people to court like for speeding. What there is currently a compliance. We want to try to create compliance.
Makes sense. Thank you.
Mr. Siroy, you had something? Mr. Siroy, did you have something?
Yes, thank you, Mr. Chairman. Mr. Beavis, what is the misdemeanor fine amount for a business that might get fined?
According to the language within the administrative rules, it's a Class A misdemeanor with a fine possible ranging from $75 up to $2,500.
Do you know what fine you're going to issue as a health department? Have you determined that yet?
No.
Just wondering, because some people might take the chance of keeping their house and paying the fine instead of losing their house.
I also want to protect my environmental health staff from any kind of...
Know that the number would be nice to know.
I don't know that it's... Is it us, Nancy, who even determines that?
It's probably actually going to be our decision, because if he writes, a lot of times when the health, and I just want to say this, prior to this, working with the health department really has been good. They write their violations and the time. So I've been at the state's attorney's office with a slight break since 2004. I've only really dealt with the health department since 2013, 2012. I would say I've only had one violation that's actually had to go to court. I mean, carry all the way through the trial, and that was because somebody was a sovereign citizen and didn't believe he had to comply with any law. So that was a unique situation. Otherwise, normally before we even get to court, John has been able to rectify the situation with the people. I mean, he works with them to try to get it done. And that's what we would envision doing here. So if we would somehow make it to the fine stage, he would write his fine. We would try to work with them, John would try to work with them to try to get that rectified before we would come to court. We would look at the seriousness of the violation. We would look at how many times, like the first time's probably not going to be as great as if it's the fifth time we're here. So there's some different factors that would go into it in deciding the fine. The fine would not necessarily be punitive. It would be something to say, hey, pay attention, you need to comply.
Thank you.
So I think you were looking for a fee schedule, you know, is it $75 for not making a reservation, and, you know, wearing your mask while not chewing is $200. I don't know that that exists right now. Maybe we could put that on the wall.
Within the administrative rules, I know that the main complaints that the health department will get and investigate is not wearing the masks or requiring the masks, and in the gathering numbers. So if facilities, for example, aren't supposed to be open and they've got people on the inside of the building, that's technically going to be a gathering issue, and we will be dealing with that facility to try to rectify it.
Mr. Featherling?
Yeah, Mr. Chairman. Can I ask Nancy something real quick and John together? Is there any particular way to know how many licenses, of business licenses or liquor licenses or anything have been pulled from the state for any violations?
I don't think we've had any. I've not gotten any. I know at one point
Nancy hear that too?
in the beginning
well, I think he's asking statewide, not necessarily in our county. So no, I don't know that answer.
Know that. I would say, I feel like in some way, and I've talked, once again, we talked about this on the Zoom call, I believe, when we all were on with Mr. Wheeler and the sheriff and state's attorney and Ms. Speckman and Mr. Beavis were on it. And we had a discussion. I think, you know, there's all these things that have been put into place, and there's really no good enforcement techniques. There's really nothing to do it. It's really going to be reliant. It's self-policing. Like John said, this county has done a great job. I mean, our numbers have been great. I mean, I still remember days where we had 0. So I think if everybody keeps doing what they've been doing, and we can maintain, that would be great.
And I will just add that before today's new mitigation rules with we're not supposed to be open to indoor dining in bars and restaurants. Understand that any of the complaints the health department is and was getting, and we've had approximately 70-ish since this all started. We investigate, we talk to the individuals who own the businesses, and you know, these were salons and barbers and you know, hardware stores and restaurants and bars and factories. We went in there, we talked to these individuals. I would have to say, if it's not 100%, it's 99% compliance. They did what they needed to do. Today, the line in the sand just became much more difficult for all of us in regards to the types of complaints that we may get and have to investigate because of the closure to indoor and those who are going to defy.
And just for a note, like when we discussed how to handle this enforcement, my opinion is that it is unreasonable to expect the health department to not only contract trace with the level or the number of people that he has available to him, but to require them to have two different set of investigation or rules, one for these emergency rules that have been put in place, and then one for this new mitigation that took effect today. My opinion is that's unreasonable to have so many different levels of investigation for him on top of what the health department already has to do. So we have decided we're taking the emergency rules, and that's how we've decided to do the quote unquote enforcement. So that allows for him to go and investigate, that allows for him to try to educate or work with the facility to become compliant with these, and it kind of gives a little bit more lee room, because ultimately, granted, sometimes when you hit people where their pocketbook is, they tend to pay more attention. But really what we want is compliance. We want everybody to work together. We don't want to issue fines. We don't want to be punitive in what we do. So that's kind of what our goals are, and that's kind of what we've interpreted, our best interpretation from the rules.
Mr. Hunter?
Yeah. Mr. Beavis, in order to protect the general public who enter this building, for example, I usually use this when I handle the, when I come in and when I exit. Is there like, for example, I go to Jewel, and I was out in Jewel Monday in Bourbonnais, and they have these sanitizer sheets that you take and wipe off the carts and stuff. And is there a possibility that we could have those kind of sheets at the entryway and the exit of this building?
The procedures and policies of every agency, every building, all those people responsible, it's kind of up to what you would want to do. There's not necessarily, masking, hand washing, social distancing is the main messaging that IDPH is pushing out, that the health department is pushing out. How you clean and sanitize and what other extra precautions you may take are going to be incumbent upon, those individuals, those administrators, those leaders, those mayors, those owners of those businesses as to what they want to do. If those are in place, as Nancy said, those will be things that we'll look at if we're investigating a complaint that you are or aren't complying with, because some people think that masks are the law. And masks are not necessarily the law. It's when you can't maintain the social distancing. So when they see somebody in a store not wearing a mask, they make a complaint. Well, the store might have 50 signs up saying wear a mask. And maybe somebody just took it down because they were trying to catch their breath, or maybe just because they felt like they were 6 feet away from somebody. That in and of itself is not going to be a violation, as Nancy described, and will be okay. But we don't necessarily want to make you do something, but I see Anita's up.
Well, and just to mention, people watch this video and they say, well, they're all not wearing masks. Well, we're 6 feet apart. People forget that that's the actual CDC and IDPH recommendations. We wear them when I've got it sitting right here for when I am not 6 feet apart. Anita, could you speak to that? Because we do have hand sanitizer all over the place.
Right, and I did want to mention to Mr. Hunter and the rest of the board, what we did here at the building, I don't know if you've noticed it, but right inside at that desk is a big jug of hand sanitizer. So as people walk in, you're free to, now the door steward is not making people use the hand sanitizer, but it is available right inside the door. For every exit, they're obviously, according to fire code, you can just push against it. You don't have to touch anything to get out of the building. You just push against the door and it will open. The other thing is we put hand sanitizers all over in this building. They're mounted on the wall on every floor and in nearly every department. So we have hand sanitizer all over in this building. The difficulty for us was when we implemented these procedures prior to everyone's return in May, was sanitizing sheets were simply not available. So we made the decision to use hand sanitizer available wherever. And I'll tell you what I do when I walk in the building is I use my jacket to open the door. I do not touch anything. I use my key to touch the elevator. Now, there is a certain amount of what each of us as an individual needs to be thinking at all times. How do I keep myself safe? What do I not want to touch? You're right. Could we have sanitizing wipes available? That's yet one other thing we'd have to try to manage.
Yeah, all I'm saying is a lot of tactile activity. When I come in the Court Street entrance, I'll get my temperature checked, then I'll make a quick left, to the elevator. I don't necessarily see the hand sanitizer station that you're referring to. So, all I'm just saying, that's just another aspect that we may need to address, that's all.
Thank you. Mr. Carrico, did you have something?
Yes, thanks, Mr. Chairman. First of all, I'd like to say thanks to Mr. Beavis for the explanation that he's been giving. I had some questions in the very beginning of his presentation. However, my questions were answered along the way. That is due to the very well done presentation and explanation by Mr. Beavis. So I thank you very much for that.
You're welcome.
Alrighty. Anything else for John today? We'll need you here tomorrow. No, I'm just kidding. Yeah,
I'm here all week, all month, all year.
Try the veal. So no, it's at times we'll be getting more updates. I think you can tell that information, we knew something was coming over the weekend. We were talking over the weekend. We didn't know what. Then when it hit on Monday, we were expecting a press release and information by noon. It didn't show up until after I left, so I came back in the office and sent out the press release along with our press release that I had prepared after talking with the health department and the hospitals and obviously law enforcement here locally. The truly disappointing thing from my perspective, beyond being, having being shackled to Will County in this way, and they're friends up there. I'm not trying to accuse them of anything. They're dealing with a bad situation. Their density is 600 people per square mile, and ours is like 120. So I mean, it's a whole different ballgame, as far as infection rates and proximity. But they gave businesses a half a day to respond, and they gave him a half a day, really a day and a half, but really from the press conference at noon yesterday till, I mean, it's just, that's unacceptable. We got to be better than that as a state government, and that's just, I would say that whoever's sitting in that office, they're dealing with a lot, but it breaks precedent. It's usually Fridays. They announce Monday for Friday. If things are going to change, and it just, everything seemed to go out the window. And when I asked Dr. Zike, who I actually respect, and I know she's in a tough spot, why the 11 o'clock number? And I said, is there data that says you can get COVID more readily at 2 a.m. as opposed to 8 p.m. or 4:30 or 8 o'clock in the morning? And she said, no, there is no data that supports the time. It was just an arbitrary number that we want to make everybody be equal. Well, that's people's lives you're messing with on an arbitrary number. At the beginning, we thought the machines were going to be off inside the business, but apparently they're going to allow you to go in and not eat, but gamble inside of the restaurants. Because people get a cut of that in certain places. So, and you know what? The restaurants and bars are thrilled, because that's kind of the thing that's keeping them afloat is the machine revenue, to be honest. That's what's making ends meet. It's not the food business. I've heard 30% of what it used to be. So I just want to mention that it's not necessarily, we don't like what happened, but the way it was done was not professional, in my opinion, at all. It left a lot of people swinging in the breeze. I mean, just think if you had a prime rib special today, you would have had to order that last week, and it all came in, and now you got $3-4 grand worth of meat sitting there that you can't even sell because you don't have a tent outside. Same thing with if you had barbecue place and you have to smoke the meat for 24 hours. That's already in there. And if you don't have a way to sell it, you just set fire to that money. Or you have friends who get a lot of free barbecue. So Steve's like, oh, where's that at? Yeah. So I just wanted to mention that this situation is just beyond any type of reason as far as I'm concerned. All right, anything else for John? All right, thanks so much.
Thank you very, very much. I appreciate all the good questions.
Moving on, County Administrator's Report. Anita Speckman.
You have the staffing report in front of you. As you can see, very little activity this week. There was one transfer between the State's Attorney's Office and Public Defender, or from Public Defender into State's Attorney's Office. That came up at Judicial, so you're aware of that. But other than that, it's been a very quiet month. So unless there are any specific questions about the staffing report.
Anything? Okay.
Okay.
I do. How pervasive is, do you have an internship program at all? Countywide at all?
Not countywide, no. Individual departments may have, but they manage those. And remember that countywide, the county administration has authority only over those administrative departments.
Yeah, okay.
Right?
But what I'm saying is that, you know, I'd like to see us grow our own. You know, I come from the city of Kankakee, and I've always pushed to have internships for all the departments if they can. Mm-hmm. And I'd like to be able to be in a position in this county to grow our own and have students from Governor State, KCC, and Olivet to make a transition to come and work for the county. Mm-hmm. And I'd just like to see that, because that helps us, and it will probably not violate any union contracts in terms of eroding the bargaining units. And I'd just like to see that for our students to get a taste of county government. Mm-hmm. That's all I'm saying.
Okay.
I will say that there are many, I guess I couldn't tell you offhand how many there are, but there are a lot of elected department heads that do have intern programs.
Correct.
And as far as since I've been here, our county's economy, at least as far as the revenue side and of the business side of running the county, has been such where we were doing layoffs. We couldn't even bring interns in because we can't lay off employees, especially union employees, and then bring in interns. So where we're finally getting to the point where we can take a breath above water. And so, to your point, yeah, we want to explore those opportunities, but we're still at the point where we probably couldn't even afford interns, you know, in the county administration departments.
Yeah, well, what I'm saying though, in terms of directed studies and college credits for those interns, that's what I'm talking about as well too. So, you know, I understand what you're saying about layoffs and bringing in interns and possibly eroding the bargaining units, and we don't want that unfair labor practice.
Did you have something on that, Nancy?
I just want to say, we have a very active intern program in our office. Mr. Rowe does that. And as the person who runs the internship program in our office, the only thing I want to say is, as we would develop internship programs, we have to be careful with the, we don't really, in our office, we don't pay our interns. Mostly they do it for class credit or just for the experience. However, because of that, we have to make sure that the work that they do does not displace work that employees would do. Otherwise, now we're not paying them fair wage, and then we would get penalized. It's huge. It's a lot of money. There's been cases where there's been a lot of money. So we have to make sure that their time here is purely educational. So we just have to watch that. If something would be developed, it's harder actually than you think, you know, because we've been short-staffed, and it's easy to want to just take an intern who's there for a criminal justice degree and throw them into like filing, but we can't do that because we can't, you know, do that. So that's something that I think as colleges, because right now I'm having a hard time because with the different colleges and e-learning and Like last spring, my internship program abruptly stopped because of COVID. So it's been weird to try to get it going a little bit. We're trying to do some work at home ones. But yeah, that's something, and I can work with Anita, you know, on that. So to make sure that we hit the right guidelines.
And you guys are pragmatists,
Yeah.
so you do the right thing.
We'll get it.
Good. Anything else?
Yes, second item, request for qualifications for payroll and benefits administration software services. We did talk about this a bit about a year ago. We've been with Paylocity for both payroll and human resources, timekeeping, and benefit administration software since November. We went live November of 2015. At the time in the resolution, it seemed that the cost was to reduce the cost about $20,000 from over $90,000 to about $70,000. That was the cost estimate. We are back up over $90,000. We saved a little bit. We're about 7%. We've had about a 7% reduction in cost. We negotiated a year ago for a price decrease for this year, but we're going to end up the year. My estimate is about $87,500. So that cost differential has kind of eroded over time. But I want to make the point that really in choosing a software of this kind, the cost outlay of our current software solution is not as big an issue as the manual workaround. So we spend a tremendous amount of time in every department manually adjusting time every pay period. There are things it does not do well, especially out at the jail where you have a 24/7 schedule. It doesn't keep time well when you go from 11 p.m. to 7 a.m. crossing a day. Doesn't work well when they change schedules. There's a lot of manual work to get the new schedules in there. And like I said, every pay period, we've got manual entry going on all over this county and corrections. So that's an issue. We have had some issue with the support for benefits administration. I spoke a little bit about it last year, but open enrollment was literally just a nightmare. The coordination with the software tech services was poor. Literally, we were going live Sunday, December 1st, I believe, was December 1st. The site was supposed to go live. That Thursday was Thanksgiving. Friday was Black Friday and a holiday here. Literally, I was here all day sending new files for them to get it fixed because it was wrong all day, and they had it correct at 5:01 that Friday night to go live on Sunday. I mean, it was so stressful, and like every deadline they said they were going to meet, they never met, to the point where I was calling them and they just started ignoring me because they didn't want to hear what I had to say. So that's part of the issue. It's I guess my question is, what I'd like to do, I don't know if there's a solution that's better. What I would like to do is issue a request for qualifications where we can have a small subcommittee from the board along with key stakeholders within this organization. Those people out there that are doing this manual work, that they can be part of the solution to see if there's a solution that better meets our needs. I've had some conversations with a couple of vendors who would be interested in submitting a proposal and doing a demo. I've not moved forward with that because I wanted to make sure that it's above board and very clear, and we're being fair in issuing a request for qualification. So at this point, that's what I'm asking for.
So just to be clear, it's not to look at a proposal, anything like that. It's to look at the qualifications, much like the space needs analysis. Look at who is the company that we want to get a number from, who is best equipped to handle our unique situations, which are based on a variety of factors, not the least of which is all the special nuances of all of our labor contracts, which require special coding for special things, you know, tobacco incentives and, you know, I mean, it's all different. And so you have to have a code for that. It's a lot of manual work. The thought was, I want to be careful in the specific, this is not a subcommittee, it's a little small work group of 3 people that we want to have that are board members that'll work with a couple of key department heads to take a look at the qualification proposals that come in. And I was hoping maybe, you know, somebody that might have been working in HR in their past and might have some experience in that endeavor, or might be a business owner and has worked with these types of companies in the past, might want to join in on this effort, just to evaluate the companies that put qualifications in front of us. So that was kind of where I was at, and I thought maybe, I don't know, I was thinking about Mrs. Haas maybe, and Carol Weber and Mr. Kinzinger, if they would so choose to take this. You know, I would imagine it's probably like 1 or 2 hours of meetings to go through the qualifications and then make a recommendation back to the executive committee. With the partners that you had, department heads, I can see probably our chief of corrections probably be one of them, or his designee. Whoever's handling time out there at the jail, because again, if they're correcting time every day, that's a full-time gig. So I don't know what for discussion point, that was the thoughts we had. Mr. Kinzinger, yeah.
What is our present contract with Paylocity? Is it an annual renewal, or we got a period of time?
Right, it was, we signed a 1-year renewal last October. That's up in October. It is then just recurring.
Very good, thank you.
And they could hit us with a price increase, because we don't have a rate locked in for that. It was just a 1-year agreement. Any other questions on that? You know, just the process? We're not getting a bid, we're just getting qualifications to see who the company is that could provide the services that we need. Because price isn't always cost. I want to drive that home. The cost of this system is much more than the 90 grand. We thought we were saving money when we did this. When was this, Jim? 6 years ago, maybe? 5, 6 years ago?
November of 2015, we went live.
Okay, we went live. And by the way, it was about, what, 2-3 months of straight work to get all those codes in there? It was a lot of work to get this up and running.
Easy, and it turned out to be a disaster.
Yeah. Again, cost and price, there's a difference there. Mr. Hunter, did you have something?
Yeah, I just need any similar situated counties like us that have the same kind of issues at all that we can compare ourselves with?
Certainly, and actually in my conversations with the corrections department, there is one vendor that many corrections departments uses. I'm not saying that's the right choice for us, but it would certainly be someone we would want to invite to the table.
Yep, so it'll be one of those, obviously, put the bid on the website, you know, put in the paper, you know, the opportunity, and then go from there type deal. And I don't
move this forward.
I would think that's appropriate.
I make the motion, we go ahead and move this forward.
Second, Mr. Lear. All right, any other thoughts on this from the group?
Yeah.
Do you have something, Mr. Payton?
Yeah.
I have something, Mr. Wheeler.
No, sir.
Go ahead, Mr. Seroy.
You know, if it's a $90,000 a year, and I don't know if this would work or maybe it won't work, it's just a thought. What if we hired a programmer that could handle all of our programming needs throughout the county, and they write the system to custom our programming needs?
After we get the system.
Can I speak?
Yeah.
I'm going to tell you that, especially in something like payroll, you want a specific software implementation and not a customized. If you run a customized program, you're not gonna get the tech support you need, number one. Number two, it's going to be outdated, obviously, the way it gets put in. These large companies, they update their systems at least every year. And when we go on, I'm gonna talk right now about the Social Security tax holiday as soon as we get finished with this. I mean,
There's a lot of moving parts, I understand.
There's a
yes.
lot of moving parts. I think we're too large for that idea.
Okay.
And just
All
so
right.
you know, also, it has to connect with all of our benefits providers as well. And those API extensions between that system and, let's say, Blue Cross Blue Shield or whoever, those are 20, 30 grand in themselves, because they're special programming from a custom system into something else. So I've had experience in that just on the back end of websites, and it's not cheap. It's not a bad idea, because we have a court system that desperately needs a programmer involved in that. But that's a $200,000 a year gig for the type of talent we would need. It's better to outsource it.
Okay.
With a cloud solution. Anything else? We got a motion and a second. Let's roll call the folks on Zoom first.
Mr. Payton?
Yeah.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Seroy?
Aye.
All those in the room say aye.
Aye.
Yes, we got your eye, Mr. Payton. All those in favor say aye.
Aye.
Those opposed, same sign. Motion carries.
There's one other thing I did want to mention, and that relates to the executive order signed last week that relates to the Social Security tax holiday that you probably heard about in the news, that the president signed, which allows employees not to pay the Social Security portion of their taxes, so 6.45%, from September 1st through December 31st. So 4 days away, and we are at this point awaiting for implementation guidance from the Department of the Treasury, which is essentially, it'll come from the IRS. The key thing, I mean, it sounds great. Here's the question. So 4 months, the executive order is only to delay. It's a holiday, it delays it. So what's going to happen in January? That's the implementation guidance we need from the IRS, where all of a sudden employees who haven't paid Social Security tax, their portion for 4 months, are going to be told that it needs to be done, it needs to be paid in 1 month, 2 months, 3 months, 4 months. So even if it's 4 months, then January through April, they're going to have double the Social Security taken out of their check. So that's what we need. Legislatively, there needs to be movement that would make it permanent. Whether or not this Congress has the wherewithal to make that happen is anybody's guess at this point. So at this point, it's a deferral. It is not a holiday, a true holiday. So that's the biggest issue, is what would it be? It's also an opt-in, opt-out. And when Todd, when you mentioned something about big, what do I want to say, custom payroll system, Paylocity already has it programmed to opt in. So an employee would go in and opt into the holiday. So that would automatically stop taking out. Now, it doesn't work right now, and our employees don't see it right now. It's non-functioning until we get this guidance telling us what we need to do. So if you're an employee, you might want to consider, while it might be helpful in the short run, remember that come January, when your holiday bills are due, you may also have a Social Security bill due.
Yep.
Also consider that the stimulus was not free money.
Yes.
It was a prepayment of your tax return. So you can't count on your tax return to pay for both of these if you so choose. So sounds good. The devil's in the details.
Thank you, brother.
So that's where we're at on the Social Security tax holiday.
Good times.
Any other questions?
Ho, ho, ho.
All righty. Thanks, Anita. Very much appreciated. Administrative issues. We have a few. Reappointment of Dennis B. Martin to the Kankakee County Zoning Board of Appeals. Is there a motion for the reappointment for Mr. Martin? Mr. Byrne, second. No Zoomers. All right, we'll go with Ms. Weber. Roll call on the Zoom, please.
Mr. Payton?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Seroy?
Aye.
All in the room, those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. I'll read through these real quick. One opening on Mantino number 9 Drainage District, 3 openings on the Regional Planning Commission, 1 opening on each of these, the ZBA, Zoning Board of Appeals. Is that, what? I don't think that's accurate.
No.
We have a full Zoning Board of Appeals. Is that correct, Michelle?
You will when Mr. Martin gets reappointed.
Oh, by the full board, okay. I see what, yeah, procedurally, you're correct. We still have an opening. Historic Preservation Commission, Essex Township Fire Protection District, and Kankakee Township Fire Protection District all have 1 opening. Under new business, holidays to be observed by the offices of Kankakee County for 2021. Are those listed in the packet here?
Yes.
Alrighty. This is a formality. This is obviously established by courts. We just approve it every year. Is there a motion on this?
I so move, Mr. Chairman.
Mr. Hunter, a second. Mr. Byrne, any questions, comments? Roll call on Zoom, please.
Mr. Payton?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Seroy?
Aye.
In the room, all those in favor?
Aye.
Those opposed, same sign. Motion carries. Alrighty. Property assessment for clean energy program. We'll leave Ben. Do you want to kick this off?
Yeah, I think it's fair. And this will be short. I've got a 41 slide PowerPoint and a 58-page contract to go
Motion
through.
to adjourn.
We'll try and get it moved through. So thank you, Chairman Wheeler, for putting us on executive. I have with us somebody you know, Tim Nugent, obviously, and Mark Pikus, who's the president of Inland Green Capital. So we kind of have maybe like I want to call it a 2-part presentation. I kind of want to talk a little bit about property assessment for clean energy. Have Tim talk a little bit about what we're hearing in the industry. People are certainly asked for this tool. And then we've got a copy of a presentation that was made by Mark's team at a webinar, was sent to the committee. Certainly, if you have any questions on that, Mark is here to answer kind of the more critical details. We've sent up both the sample resolution that was included in the board packet and the subsequent agreement to the state's attorney's office for review. And at the pleasure of the committee, we can kind of move at whatever speed you think is appropriate. So kind of in a nutshell, property assessment for clean energy is I don't want to say it's a relatively simple tool, but it's a tool that we can utilize to make sure that it's a financing option for development of retail, industrial, sometimes multifamily or hospitality. It's a wholly voluntary program, and it functions a lot like a special service area. So this is a tax that is placed wholly voluntary, I'm going to say that a lot, on a property tax owner's bill, and then is collected by the county treasurer and collector, and then is paid to essentially a lender which specializes in third-party or second-party non-recourse lending, which becomes part of a capital stack for developing. So if you're an existing business or a new business that is looking to build with energy-efficient materials, you can borrow up to 25% of your total project cost on a much longer loan. I mean, we're talking about up to 25 years, and it really makes the capital stack work a lot better for businesses. And in a lot of cases, and Mark can certainly speak to these, there's not been a lot of cases that have happened in Illinois. the cost savings on the energy efficiency alone are typically close to enough to pay the note. So we've got owners of buildings that are able to utilize energy savings to help pay back long-term loans so they can make development deals make more sense. It's a complex tool. It's a long process to kind of get underway, but kind of in a nutshell, we're talking about the county goes out, and some of our neighboring counties have done this, Will County, DuPage County, Kane County, to find a vendor to manage their PACE program. We would, in Will County's instance, they went through an RFP process. I talked to Chairman Wheeler about this. They saw one respondent. The one respondent they saw is the IECA, and that is the firm that was spurred out of Inland Green Capital that Mark represents. So in talking with another body politic of the state of Illinois and the Illinois Finance Authority, what we initially thought would be a better process of going out and doing an RFP or an RFQ to select a vendor, we're now finding that partnering with a vendor and finding stakeholders in a deal is a better process for moving forward. So today we have Mark on the phone and to talk a little bit about the program, and again, we can dive into any detail, but before we do that, I want to bring Tim up to talk a little bit about some of what our partners are telling us. We've got developers that are working in the area and also lending institutions that lend on either the PACE side or the conventional side that have been giving us a little feedback on this program and kind of how they're using it in other areas.
Yeah, as far as the economic development side, I mean, this is one of another tool basically in our toolbox. You know, you're all familiar with the enterprise zone and TIF and new market tax credits, historic tax credits, and things that we have. The CPACE funding is another one of those tools, and people that are out there, investors that are out there looking to come to Kankakee County and specifically the city of Kankakee, are looking for all the, you know, the tools that they can use in order to make, you know, make the investment a little more palatable for some of the areas that they want to come into. Like Ben said, this operates real similar to a special service area. It's not it's not something that's imposed on anybody. This is voluntary, and it can make a project that might not be financially palatable be able to make it work because you spread out some payments over the course of 20 to 25 years, and it's paid through the tax bill. So it gives people some upfront capital to make these investments with. To upgrade their energy efficiency. You know, they might be able to use this to pay for windows or insulation or HVAC systems, LED lights or solar panels, things that they're going to be putting in anyway. Here they can finance these things up front, pay for them up front, and then hopefully the savings that is generated over the course of the 20-year life of these things will be what's used to pay them down, and they're guaranteed by the taxes. So the finance people are very happy to see that it's got a guaranteed return, a guaranteed income coming back through the county and through the finance. Now, it's not anything that's going to cost anybody else any money. This is specific to a building or specific to a development. It's not specific to a whole community. The only people that would be paying these taxes are the ones that are partaking in this benefit. And I suspect that when property might get sold, these things will actually show up on a title policy where there'd be no mistake if somebody transferred a building and there was these special tax areas or special taxes on this building. They would show up in a title policy so everybody would know what they're buying and what's required. So again, it's another tool in the economic development toolbox. We do have a few individuals that are looking in Kankakee that have used these tools in Milwaukee and other areas. Like Ben said, it's kind of complicated, but it's one of the things that the government approves, but it really doesn't cost the government any money after it gets approved. It's paid for by the taxpayer or the owner of the building.
So you know what, I've met with Ben on this a couple of times. We got on the phone with the Illinois Finance Authority, talked with them. Want to make sure I understood this. What's our risk? And there is no risk on the county side. And we can take this action for all of Kankakee County. So it doesn't matter which municipality you're in. It's my understanding, and we'll get into that verification in a moment, but if we take this action, it allows Kankakee and Bradley and Bourbonnais and Momence, everybody to take advantage of this. They don't have to do anything on the local level. Now, we'll verify that and make sure I'm accurate in that statement, but that's what I took from it the first time. And it's not an extra burden, if you will, on the treasurer. It's just another line item on their tax bill. So once it's entered, it's not going to be anything. It's plug and play. That lender, the risk, they're taking the risk on the project. So if the property, sits there dormant, the people go out of business, the building is shut down, whatever, that's not our risk. So I just want to mention that. That's what I was led to be as well, and I want to make sure that that's all out there on the table and that the lender actually addresses that with this board, because I'm sure that's what you're asking. What's our end of it? What are we risking here as a governmental entity? Yeah, Mr. Kinzinger, before we get going.
Yeah. I'm a little bit familiar with special service areas, did some investigation in that. And one of the negatives, which we need to think about as a board, is if you have a building that has a special assessment tax sitting alongside of another building that doesn't, it's hard to keep selling that building at the right rate and maintaining it. Most of the money goes out in the front, and then the maintenance a few years down the road becomes a problem. That's because they're paying extra in taxes, and they're going to pay them for 25 years, and it affects long-term viability of a building in a particular area. That's the only negative I can think of. It is an advantage.
Sure. And I wonder, and to that point, I wonder if the savings for energy efficiency makes it attractive in that sense, because their money is going to be better spent in that area.
Most building codes today require such energy efficiency, and most developers are already looking at it. I think it's more a case of a non-recourse 25% equity investment, which makes sense. And I think it's a developer decision. The only risk that we have is the long-term viability of that building setting alongside of another building. That's the only risk.
So with that, Ben, I think that might be a good lead into at least a couple of concerns and questions into whoever's going to answer those questions, the presenter. So
I saw Mark came off mute there for a second. I'm assuming he'll come off momentarily, and I really look to his expertise on this. But I guess the one, back to Chairman Wheeler's point on in talking with IFA, what we don't want as a state or a region or really anything is a bunch of individual jurisdictions managing PACE programs with different rules. So the idea that we have standardized rules, and that's really why in talking with IACA, this is so very attractive, and that they are Will County's administrator. They're administering DuPage County and I believe Kane County's program, where these are our neighboring communities in Chicago metro region. And if you go to do work in Will County and you need a CPACE to make your cap stack work, you're not going to see different rules if you come to Kankakee County by standardizing these rules to where the city of Kankakee doesn't have different rules than Bourbonnais has or Bradley or the county proper. So we're able to really kind of level the playing field, at least as this tool, similar to the way the playing field has been leveled for enterprise zone or how TIPs are managed statewide, where it's one tool.
Okay, and Mark, I believe.
Hi, good morning. This is Mark Pikus. Can you hear me?
Yes.
Wonderful. Yeah, I saw a couple questions. One about a property kind of having an unfair advantage. I agree with someone's comment that property would probably be more efficient. And also, even though their tax bill might be higher, that property probably would look a little bit more attractive. But there's always that possibility that it might sit there if no one maintains it. But I think that's more of a risk of the property owner. As far as risk to the county, I believe since PACE is going to be paid back on a tax bill, I think your taxes are due in June and September. If someone becomes delinquent and they go through the tax certificate sale process and nothing amounts to that, there's no investor, and you're right, it just sits there, there would not be a risk to the county. It would go maybe through the scavenger sale process, and that is a risk to the capital provider. That is their downside risk.
Yep. Thanks for clearing that up. I want to make sure that was accurate and brought to the attention of the committee. So it's what we're being asked here is are we, okay to move forward on this, to make this tool available to all communities in Kankakee County? I strongly believe in it. It really helps in the hospitality area when they're renovating some of these hotels that may be shut down right now or other things. There's other, new windows on a building that is being bought to turn into housing. I'm just throwing out there, for instances, geothermal, solar panels on the roof of particular housing developments. You could, it just has to be for profit. It can't be government entities can't take advantage of that because we don't pay tax. So that's really about the only limitation is that it's and I'm correct in that assessment too, right, Ben? Everybody?
Yeah, we are ineligible to utilize the funds.
Yeah.
But there are instances though where local business owners, and again, in researching this just for the edification of the committee, we have a relationship at the Alliance with Twain Financial, which is a spinoff of U.S. Bank, and we were talking to them about PACE, and obviously we've been talking to developers about PACE. We got initiated with the Illinois Finance Authority, and I've got a lot of this would kind of work, and there are local manufacturers that need a roof that maybe the bank doesn't want to loan more than 65 or 70%, and because of the way the materials are being placed into service, this could be potentially a PACE eligible piece. There are projects that are being conceived that could potentially be 100% financed through various tools in that capital stack, where it really could make sense for that user to reinvest in an existing business that they maybe have been reluctant to do because of the concern of using personal money in that cap stack, right? That equity piece doesn't always go as far as it should, and sometimes you've got to really put up on some of these deals, hospitality being one. 65% of the loan the banks or conventional lenders are comfortable with. That's a big delta in that financing stack. So, there's ways to utilize this. I do have, I sent, I don't know if Kelly wants to share it or if she wants me to share it. I sent over a timeline. I believe it was included in your packet. I just want to get everybody aware kind of what we're talking about as a program has been concerned. Actually, I believe Chairman Wheeler and I started this conversation back in around November of last year and really trying to exercise exactly what the best approach would be for us and how the tool could work. But what we're looking at now is to initiate with, IECA, so, allowing a resolution to be passed at the county board. The state's attorney has the contract and the sample resolution for review. To initiate with IECA. Once IECA, I don't know, Kelly, if you want me to share or you can share?
You would need to share.
I'll share it. There we are. Once we initiate the contract execution, we then have to go through the completion of drafting a report. So, IECA would then, with the assistance of stakeholders in the county, put together a report. That finalized report would come back to the county board for review, and then an ordinance codifying all of this would be passed. So there's still a couple stages that need to be taken, steps that need to be taken, and the board would be able to re-review and reauthorize some of these pieces before we would get into that kind of formal 4th or 5th month project launch. And that's kind of, I'm not saying that couldn't be truncated, but this is kind of a sample timeline that Anna Maria works with Mark and their team sent over as part of kind of our packet, a ton of great information, and I tried to share some of it with you in case you had any specific questions, but it's a lot of detail that we've been crunching through over the recent times. There's still a couple steps that we need to take to make sure that we get all of our program report, and keep in mind that when businesses are borrowing for this, they're getting energy assessments done and they're making sure that they're doing things right. And then the PACE administrator is responsible for ensuring that the investments made do qualify to certain standards to save energy, to create that CO2 reduction or reduction in overall therms, so that way they do see notable or market savings on their energy going forward.
I think I'm seeing head nods here, so I think we're getting close to having everybody having their questions answered. Yeah. Sorry, we're just want to make sure everybody's clear. The one thing that just occurred to me, and I've got to ask it, because it's through the county, if you will, and the tax assessment process, is all of the work done on these properties subject to prevailing wage and all the other things that we're subject to if we were doing the work? Does that make sense, the way that I'm putting that? Is there things that are tied to it that we may not have considered because it goes through the county? Because I know that the people who would want to take advantage of that would want to know.
Mark, if you have a quick answer on that, whether it's considered to be a public improvement or as defined by the Illinois Prevailing Wage Act?
Yeah, I think that's it's a good debate to have. I do know that there are certain bonding authorities like the IFA that would probably require it, and some counties want to adopt it regardless. We're indifferent to it. I think if you do prevailing wage, you might risk having a contractor, maybe a local contractor, who might be excluded from participating in projects, maybe the smaller guy. But other than that, we've seen that work across Illinois. I have a couple of projects to do it. I have a couple that don't. So I think that's something the county might want to discuss. And like I said, I think that's a choice of the county.
Sure. Okay. So if we're ready, is there a motion to approve, moving forward on a resolution of the full board, this program, Mr. Kinzinger? Is there a second?
I'll second that.
Second from Mr. Hunter. Any comments, questions?
Candidly, gentlemen, I really appreciate the thoroughness of your explanation. I'm familiar with special service areas and TIFs and so forth, and I like the comparison. This is, and to plagiarize Mayor Nugent, is another tool in our toolbox of incentives for developers and businesses. And I think you guys have done a magnanimous job of explaining this. Thank you.
Any other questions, thoughts? All right, we're not spending money, but we'll still roll call the Zoomers, please.
Mr. Payton?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Seawray?
Aye.
In the room, all those in favor?
Aye.
Those opposed, same sign. Motion carries. All right, last item. This is something that I asked about. We received the notice that our long-standing chairperson of the Historical Preservation Commission, Martine Hinton, was retiring, if you will. And my thought was this is a little bit different because she was part of the group that actually got this going with the county way back when. So Michelle works really closely with them, and I guess, am I accurate in that assessment that she was pretty much the linchpin along with a few other key people to get this thing going, and then the direction that they currently are on?
Yes, that's correct. She's been on there since the beginning. She was off for a couple years. She's been very instrumental in getting a lot of programs going with our CLG grants, with landmarking. She's been doing a lot of research on the back end of our grants. So she's been very instrumental, and she will very much be missed.
So would you be able to, if this committee chooses, would you be able to work with the state's attorney's office to come up with the whereases and what it would look like and all of that kind of stuff? Because I think you have that knowledge better than we do. So I just asked, Del and Michelle specifically to be here in case you had questions about Martine's role and what has gone on in the commission, because it's been really good work. So is there a motion to approve and send this to the full board? Mr. Kinzinger, second. Mr. Lear. Zoom, roll call, please.
Mr. Payton?
Aye.
Ms. Haas?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Seawray?
All in the room, say aye, please.
Aye.
Those opposed, same sign. Motion carries. Thank you so much. Old business? New other business? Mr. Hess? Motion to adjourn? Is there a second from Zoom? Seroy. He gets a second. All those in favor say aye.
Aye.
Those opposed, same sign. Have a great day.